being involved with our professional association has made all the difference for me for making changes, because it's one thing for us to speak out as one individual, or that's fine if I'm talking to my specific legislator to be like, hey, this is an issue and things I'm coming across. But to explain that to the rest of the legislature, it's much different when you can talk on behalf of all hygienists, or everyone in your association, and not just myself. Ways to get involved and to help with that, or just being involved, and member or not, reach out and find out when your day at the Capitol is. Attend. Like, know that it doesn't have to be this scary thing. There'll be stuff provided for you, and education on how to do that, and how to just talk with your own personal legislators and stuff about what's going on and why it's important, why it not only affects your job, but the kind of care that's going to be available in your community.
A tale of two hygienists.
Welcome back to A Tale of Two Hygienists. I'm Jessica Atkinson, here with my illustriously curly-haired co-host.
David Torres.
And we are so excited for today's episode. We have the one, the only, Danyelle Evans.
And listeners, Danyelle Evans is a registered dental hygienist with over 25 years in experience, a strong focus on advocacy and access to care. She serves as a legislative chair for the Utah Dental Hygienists Association, where she helped pass direct access legislation and secure Medicaid reimbursement for hygiene services. Danyelle also works nationally in oral health advocacy while continuing to practice clinically and run a mobile hygiene practice. Welcome to the episode, Danyelle.
Thank you for having me. I'm so excited to be here with you both. Danyelle is the OG of mobile practice in the state of Utah, and I was impressed to have her on to tell you, our listeners, how you can go from wanting change to creating change to impacting change for more than just yourself. Danyelle, why are you the OG? Like, I mean, I tiled you that, so I know why you're the OG.
I know.
I know, yeah. For me, I think it just started. I was working private practice, doing my thing, working full-time as a regular clinical dental hygienist for quite a while, and so I think I was like 8 years into 15 years at the same practice when one of my favorite patients started aging out. So I had this couple that used to come see me, Ron and Kathy, and they were just fantastic. They were an older retired couple, just totally put together. He was a prominent architect up in Salt Lake City when he was working, and they would just come in, and they were just a joy to be around. Those people that took great pride and care in their overall health and their oral health. So when I first started seeing Ron, he had like barely recognizable Parkinson's disease. Like sometimes you can see just a little
No tremor.
shake in his hand, things like that. And he had still just this beautiful home care, an immaculate smile, this beautiful cosmetic smile. He had, that tight knife edge, pink stippled gingiva that we
the
like to
unicorn
see.
mouth.
Yes, unicorn mouth for sure. And so it was like they would come in, it would just be like we were just visiting, catching up, it's just like a friendship, like we do as hygienists, and build these relationships with their patients. They'd sit and tell me about their trips they had planned with their grandsons and things like that. And of course I'd, remove the biofilm and stuff like that. But it was just more chit-chatting and visiting than really like healthcare, it felt like, because they just did such a great job. And then over the course of, the 8 years that I had been seeing him, his disease just started to progress, and Kathy ended up having to move him into an assisted living facility. His Parkinson's was just getting too much for her to handle at home. And with that, his medications increased, his xerostomia increased, all while his dexterity was decreasing. And what used to be just these totally healthy visits turned into him coming in with just teeth that were just bombed out time and time again, you know? The dentist would come and do, 3, 4 surface fillings, turned into crowns, turned into patching class 5 areas, and so he was coming in with more frequency, but it was just still like no match for it. And the last time that he came in, I was walking a patient out and I could see outside the windows that Kathy was struggling to get him out of the car and into a wheelchair to bring him in. And so I thought, okay, I got to go back and wipe down my room and get my notes done so I can hurry and come back and get him. And by the time I came up to get him, Kathy had left. Ron had an accident. She found the need. She had to take him back to the facility to get cleaned up. And it just absolutely broke my heart to see him like that and to see them like that and to have to go through that. And I just thought, this is absurd that I can't go to him to help him maintain not only his oral health, but his dignity.
Yeah.
And at the time, like we could go into public health settings at the time in Utah, but we had to have a dentist come and do an exam first, and then the dentist had to come and do an exam every 6 months in order for us to do that. And I don't think we work with heartless dentists or anything here, but
No.
it's just not financially feasible for
Or
a dentist to leave their practice,
or even
right?
physically feasible.
Mm.
Yeah,
I
yeah,
think if it was all of my patients end up in this assisted living home, so I can go to one and I can have some designated time to this place, but when it is a situation where you are running your own practice, seeing patients 8 to 5, and are going to 5, 6, 7, 10 different places twice a year in order for your dental hygienist to continue preventative care is unrealistic.
Mm.
absolutely. Yep. And that's exactly what was going on, and I just thought, something's gotta change. Like, there's gotta be a better way, and there's gotta be something else that can be done, and
You
so
you have the skill, you have the flexibility, you have the desire to make a difference. Every time you tell a story,
yeah.
Danielle, I get the chills every single time.
Oh,
And I think about, hygienists that are listening and thinking about their patient population that we get attached to, and maybe they have somebody in their mind that they're like, "Oh, I remember, just if I could go and see so and so in where they are at and do place-based care, what a difference that would make."
yeah, yeah, for
But
sure, and that
you couldn't do it. You couldn't
I
at that time.
couldn't I couldn't, and I was really frustrated because I live down in Southern Utah, which is about, 4 hours away from our state capital where all the changes and stuff are made to change the situation where we could do it, and so I was just like, "What's my association doing for me? Like, what all those hygienists are up north, like, why aren't they there, doing something and trying to make a difference with this?" And then it just really hit me that I couldn't expect them to do something that I wasn't willing to do myself, and that's how I inadvertently became legislative chair for the Utah Association.
That's word.
So so I just haven't stopped, one thing's kept leading to another, and um it's it's been a great ride stepping up and getting involved more.
So, Danielle, what challenges do you see clinicians facing today that maybe policymakers often don't understand?
I don't think they understand the issues we come up with. I think we're dealing with this a lot here in our state and states across the country with this idea of that we need supervision from our employers, from dentists, and not just like supervision should be about the supervision of patient care, like total patient care, not the supervision of another licensed professional. And so I think that is something we face as you look at, like, wanting to go out and do your job somewhere else. Like, how am I safe and effective within this little box here within these 4 walls, but nowhere else? And so I think that's one issue. I think we get caught up inadvertently in, just the way dental practices are set up. They're not really set up to implement other change. And there's a lot of stuff going on now, a lot of new things that help with prevention and minimally invasive care and things that we could be doing, but our offices aren't set up to allow for us to implement stuff. And I think it leaves a lot of hygienists feeling frustrated and as like they're not as impactful as they could be for patient care. And I think it's hard to get that message across to legislators that it's not like we're trying to break away from dentists and fragment ourselves, but we still very much want to collaborate. But we want to be able to make those clinical decisions and provide and offer all the services that we're capable of doing for our patients instead of it being like, you have an hour if you're lucky and you got to fit everything into that versus having that capacity to provide so much more.
Well, you mentioned that hygienists oftentimes feel frustrated wanting to do more than what they can do. Where
More
do you
than they
think they
have
should
time to
start?
do.
Yeah,
Yeah.
where do you think they should start, or what should they do? How can we kind of like stop venting and actually make something happen for that change?
For me, I felt like it's being involved with our professional association has made all the difference for me for making changes because it's one thing for us to speak out as one individual or, that's fine if I'm talking to my specific legislator to be like, "Hey, this is an issue and things I'm coming across." But to explain that to the rest of the legislature, it's much different when you can talk on behalf of all hygienists or,
Mhm.
everyone in your association and not just myself. And so that was just really impactful for getting involved. I think it was the first year I attended the national ADHA meeting was the first year that it hit me that, like, ADHA isn't this far off place of all these people that are supposed to be doing all this stuff for me because I paid my dues, but that I am ADHA and you are ADHA,
Mhm.
and because you're part of that association, there's policies and resolutions that are there that stand behind you. So, like, it allowed me to use my voice and speak out knowing like, "Hey, I'm on the right side of this because I have this whole association that believes this and backs this too." And so being able to use your voice in a more impactful way. And I found when I started doing that, it allowed others to use their voice too. So our first day at the Capitol that I put on because I was like, "Hey, something's got to change for Ron and Kathy here," was like 8 other hygienists sitting around a table trying to figure it out. Like, I had no idea what I was doing, but I just kept
And
showing up and
now
building on it and networking with other people
yeah.
who've done this in other states because it wasn't brand new. This wasn't, breaking ground here. It was the first time being done in Utah, but there were other states that allowed for that, so
But it was seeing that other people had done it and you can use that momentum and incite change. Danielle, I have had the opportunity to sit at your feet and to learn the ropes of legislation. You talk about your understanding of the importance of being a member of your association. Can you speak to how legislators see associations? How legislators see white papers, how legislators see when you're on at this level of conversation, why those things matter.
I think those things matter because it shows that it's not just a one person problem, that there's other people out there that this is affecting more than just me. And having those resources just helps because it provides like evidence-based information for them. So it's not just me speaking and saying this, but there's actual stuff there that's backing that's letting them see a broader picture of what's going on and an idea of the issue a little bit more than you can explain in just the few minutes that you have their attention
And it
during the
holds weight.
session.
It holds weight.
It does.
Association platforms hold weight. Like
Absolutely.
if an association feels one way, that holds weight at the legislative level, which is something I really didn't understand until I was nose deep in in this and going, oh, those kinds of things are. are speaking louder than I thought they did.
Yeah. It's bringing a larger number of people to the table when you can speak on behalf of an association.
I
So,
think being able to kind of have like that sense of like accountability, like, wait a minute, I don't know what I don't know. And oftentimes we have these stories where we have these patients that we wish we can do more, right? But it's not until you network, it's not until you ask other hygienists that are out there and they're creating and navigating this change where you feel inspired. And so, like, I am extremely honored to get to, ask you all these questions because obviously there's listeners out there that they wish that they can do so much more on a day-to-day basis, and oftentimes we kind of have to go through a heartache or break when we realize that our patients are, showing those symptoms, and
mhm.
we're only as tied to our practice and our chair. And so I want to encourage listeners and advocate for themselves, for their patients to, obviously outreach and get to know the process because we all can make change starting from our chairs, of course, but day-to-day change where legislation can become impactful. It just takes that one person to have that moment of realization. And so, tell me about these Medicaid reimbursements. And why is this so important? And I believe that obviously like being able to kind of have more of that resource is what gets us to kind of do more for our services.
Yeah, I think so. So we ended up passing that direct access in 2015. So in the state of Utah, patients have direct access to the services that we provide. And that was great and wonderful. But when you start doing that, you need to be able to sustain your programs. And so that's what we found out was like, oh, we need to be able to be reimbursed. We can't just volunteer our way through this. So that was a crucial next step was to being able to become a Medicaid provider. And again, like I said, I didn't know at the time. I didn't know what I was doing. I was learning every year. So we passed direct access and I thought, well, great, let's contact some insurance companies now and see if they'll, enroll us as providers. And I thought, oh, I've heard like Delta Dental in California reimburses hygienists. I'm just gonna call them up. So I did. And they're like, oh, that's cute, but you need to be recognized in your state first, like through your state as a Medicaid provider. And then that's when you can start
You're like, "It was cute, come
branching
on."
out, looking I mean, like, uh, that's what I'm just saying. I think a lot of people feel like, "Oh, I don't know how to do that," and I just want people to know I didn't either, but you just gotta be afraid to not fail and to ask the dumb questions and figure it out. So, that's where we started as a state, going and reaching out to our state Medicaid department and coming to an agreement on, "Hey, these are things that we are qualified to do. These are the services we're providing. Will you provide reimbursement for them so we can sustain these programs and keep going? Because if you can't get paid, you're not gonna be able to, you know, continue to run a program nonstop on grant funding alone and
And the
all of the
sheer
red
will
tape
of
that comes with
heart.
that." Yeah. Yeah. So,
Do you remember that moment where you officially got the yes, like okay, like your the funding has been approved, and how did that feel?
I mean, it just felt great. I felt like we were finally being recognized. There had been so many times that we had gone up to the Capitol and would sit in committee meetings and talked with the legislators about advocating and why we needed this stuff. And it had always come down to like, well, what do the dentists think? What do the dentists think? And it finally got to a point where we were showing up enough and talking about the right things that they stopped asking those questions all the way and trusted what we were saying as well and recognizing that. And so there was so many wins that came with that of them, hearing our voice and hearing our needs, that it was just amazing because I just thought it's going to just open up all of these avenues where people that haven't had access, that maybe they have a Medicaid benefit, but still lack the ability transportation wise or cognition wise or any of these other things to get into a traditional setting where a Medicaid dentist was. So it was awesome.
Where it really caught on for me is to see it grow and see how, look, Danielle is doing it. Danielle has created a business doing it. She is sustained doing it, and you can do it too. And I would like to see this type of thing just penetrate the heart of every listener and go, I can do this too. I can do it once a month. I can do it depending on your state. Let me just preface that. Well, you not every let me rewind. It's got to, you've got to make sure that it's legal in your state. And if it's not, you can make a change. One of my favorite stories that was shared earlier on the podcast was Shelly saying, I got started with my mobile practice because Danielle referred a patient to me, a retired dental hygienist, and that we want to be able to provide good quality, comprehensive care to these patients that really deserve it, whether or not they're able to come into a brick and mortar office or not.
The the ripple effect you have created, that has to feel amazing. And, for listeners who doubt themselves that if they can ever make a change or anything like that, just listen to these stories. I mean, my goodness, being able to be responsible or be the reason why others are doing the same and uh, outreaching with their programs to be able to provide patient care, their lives that are being changed and their smiles has to be amazing. Do I have goosebumps? I think I have goosebumps. This is exciting.
Talking with Danielle is goosebump inducing for sure. And her work has not stopped. She is still our state legislative chair. And as everybody is feeling in the country, that there are lots of changes on the horizon. And it's never ending. So right now across the country, we're all looking at potential of assisted scaling and on a number of different things, and depending on your state, while you're simultaneously trying to be able to do more, there's a feeling that there's a there's lots of feelings in the air. And Danielle, I'd like you to share a little more about what is currently on your ripple effect trajectory.
Sure. So we've had these great wins in Utah, and I have to say this has been my absolute honor to lead this committee and to help with this charge. But it's also come with surrounding myself with other amazing people. So when we did pass direct access in Utah, immediately after that, our state president at the time started a public health access committee. And so when we were able to open ourselves up to these public health settings, this committee went in and set up a model of what this looks like, of what does it look like to do school-based program? What does it look like to provide care in an assisted living facility or long-term care facility? All of the things that were listed in public health, and provided a model so then anybody could come and plug themselves into it and help expand and make this grow. So I wanted to start with that, and as we've then progressed to Medicaid reimbursement and officially defining what teledentistry was 5 years after the fact that we were doing it, and having that in there. There's been setbacks along the way too, and last year was one of those. We've had some regressive language that got put in, but it's that push and shove and that give and take of where you're getting something and something maybe, inadvertently lost. So we're still plugging along. So this year we are in one of those still plugging along years that we are looking to increase what public health settings are. We would like to see hospitals and medical settings listed as a place that we can go and practice without requiring a dentist examination first. We need to reinstate what palliative care is for a dental hygienist back into our Practice Act in our state, and a few other things, all while trying to work within our dental association. Our legislator that's running a bill for us this year brings them to the table when they bring us to the table, and we've tried to have those collaborative conversations. So with that, we're looking at the possibility that lots of other states are looking at of dental assistant scaling language in our state and trying to navigate what that looks like, that, "Hey, we still need to get this, but we don't want to give our scope away in the meantime as well." So we're looking at how to address that just like all of these other states are, and just bringing up the issues that are important around it, that when, it's looked at as this hygiene shortage, of making sure we are including that shortage from the data that Health Policy Institute did shows it's a retention issue, not necessarily just a shortage issue. And so
I
pointing
am
that out,
short.
that
That's I mean, there are short hygienists, but there's not a shortage of us.
yes,
Mhm.
yes. So, but pointing out that it's hygienists feel there's a shortage of like places with good workplace culture, that they want places where they can practice at the top of their scope. Things like that would help of um, professional satisfaction that comes through having that autonomy, and just different things like that. And we're just trying to point out that if we need to increase provider types, then, if there is a true shortage or rural areas need more providers, that we should be looking at dental therapy, and adding a mid-level provider that has an evidence-based education and has been a proven model to improve access to care, and looking at maintaining and increasing those standards of care, with a mid-level provider, not below level providers.
And
Um,
giving providers that are already educated, capable, and have the capacity, the autonomy to work in settings without needing all of this unnecessary supervision.
yes,
Yeah,
yes.
and how can we help? I mean, what role do conversations like this on a podcast or social media and the office level play in making that change? Because I can think of if a frustrated hygienist is listening to this right now, what do you want them to hear about this? I mean, office culture, our scope, what
Breach of
are some of the
Practice
things that
Act.
Yeah.
yeah.
Well, I think a lot of that comes, I'm like, there's hard things out there. Like, there's a lot of practices that are, that struggle financially when you look at low reimbursement rates from insurance and things like that, that if those were increased and, you know, practices were bringing in more money, I think that could solve, some of these issues. You know, hygienists would perhaps have the opportunity to get benefits offered, or, have good equipment, or not have their appointment time shortened, and things like that. But also opening up that professional autonomy where you're allowed to make those clinical decisions, I think does a lot for culture and your ability to feel good about the care you're providing for your patients. So I think ways to get involved and to help with that are just, being involved, and, member or not, like, reach out and find out when your day at the Capitol is, attend, like, know that it doesn't have to be this scary thing. There'll be stuff provided for you, and education on how to do that, and how to just talk with your own personal legislators and stuff about what's going on and why it's important, and why it not only affects your job, but the kind of care that's going to be available in your community for people, and the kind of care that people deserve. Like, they deserve to have high standards of care, and I think that's a big thing, continuing just to educate, not just our colleagues on these issues that are going on, but the public, your family members, your neighbors. They can be a great resource in advocating for wanting quality care as well.
Mm.
Um, I so those are just a few things of getting out there and getting involved. So I'm like, it doesn't mean you have to be, member or not. You're going to be invited to your day at the Capitol. You're going to be invited to get messaging on how you can speak up and the appropriate times to do it, to help ensure that we're keeping a standard of care for, the citizens across the country.
Kinda
Absolutely.
reminds me of that quote. What is that quote? It says, "Be the change you want the world to be," right? Like, it's like, oh,
Yeah, it's a Gandhi quote. Be the
is it?
change you want to see in the world. Yeah, I think it
Yeah.
was Gandhi. Anybody?
Yes,
Anybody? Gandhi.
yes, it is. I
Be
use
the
that a
change,
lot.
and I did it. Yes, I knew Danielle would know because she has been the change that she wanted to see. And if you have been listening to this podcast today, feeling that frustration, feeling that ugh, that gut feel that you want something to change, you want things to look different, know that it starts with you. And here is an example of Danyelle who started calling, started acting, started getting involved, and has made a change that has had ripples that she can't even see. And I am so grateful that I know you, and I'm so grateful that I could be part of that ripple effect. And thank you so much for coming and inspiring yet another hygienist who's been listening that's going to go and call her legislator, write a letter, put her name on a Google Doc, his name, thinking his, hair, their, everyone. No respect for persons here. That's a dental hygienist, and start.
Advocating.
Yeah.
Thank you, Danielle.
Well, thank you for having me. It's
It
been a
was our
pleasure.
pleasure.
You're welcome anytime.
That's a wrap on today's episode of A Tale of Two Hygienists podcast. If this conversation made you feel seen, inspired, or even just a little fired up, share it with a fellow hygienist or fellow dental professional. Share it with your neighbors, your friends. Share it with everyone. That is how this community grows.
Make sure you subscribe, leave us a review, and connect with us on social media so that we can keep on going with this conversation. Remember, your career, your voice, and your story matter here. We're David,
And Jessica,
and until next time.
keep learning, keep laughing, and keep showing up for yourself and for each other.
This has been a production of Endeavor Business Media, a division of Endeavor B2B.